Ambulances in Kansas race toward hospitals before abruptly changing directions due to overcrowding. Employee shortages in New York City create delays in garbage collection and subway operations, as well as a reduction in the number of firemen and emergency responders. Security checkpoints at Phoenix's busiest airport have been shut down, and schools around the country are struggling to locate instructors for their classes. The current outbreak of omicron-fueled coronavirus infections in the United States is disrupting essential operations and services, the latest example of how COVID-19 continues to upend lives more than 2 years after the pandemic began. This really does, I believe, remind everyone of when COVID-19 first arrived and there were such tremendous disruptions throughout every aspect of our daily lives, said Tom Cotter, Director of Emergency Response and Preparation at Project Hope, a global health group. And the awful fact is that we won't be able to forecast what will happen next unless we raise our worldwide immunization rates. To keep the public safe, first responders, hospitals, schools, and government organizations have used an all-hands-on-deck strategy, but they are not sure how much longer they can keep it up. Paramedics in Johnson County, Kansas, work an average of 80 hours each week. Ambulances have been known to be compelled to change course when the hospitals they are headed to say they are too busy to assist, which confuses the patients, already worried family members traveling behind them. Because there are no beds available when ambulances arrive at hospitals, some emergency patients are forced to wait in waiting rooms. When the head of a rural hospital had nowhere to take its dialysis patients this week, Dr. Steve Stites, Chief Medical Officer at the University of Kansas facility, said the hospital's staff checked a textbook and tried to put in some catheters and find out how to do it. He described the situation as a double punch for medical institutions. COVID-19 patients increased from 40 on December 1st to 139 on Friday at the University of Kansas Hospital. At the same time, more than 900 workers, or 7% of the hospital's 13,500-person staff, have been afflicted by COVID-19 or are awaiting test results. What I'm hoping for, and what we're crossing our fingers for, is that once it peaks, it'll have the same quick decrease we saw in South Africa, Stites said, referring to the country's dramatic decline in the number of cases. We have no idea. That's all there is to it. The Omicron version spreads far faster than other coronavirus strains, and it has already taken hold in a number of nations. It also infects persons who have been vaccinated or have been infected by earlier versions of the virus more easily. Early investigations reveal, however, that Omicron is less likely than the prior Delta form to cause severe disease, and that immunization plus a booster still provides substantial protection against serious illness, hospitalization, and death. Despite this, its ease of transmission has resulted in an increase in cases in the United States, harming companies, government offices, and public agencies equally. Customers lined up outside a pharmacy in downtown Boise, Idaho, before it opened on Friday morning, and the line wove its way inside the big drugstore. Staffing shortages have hit pharmacies, either because workers are unwell or have quit completely. Prior to the epidemic, pharmacy worker Anisha Mascaro said the Savon pharmacy where she works usually had prescriptions available the following day. The hundreds of orders that are coming in are now taking much longer to fill. The demand is insane. Everyone isn't obtaining their prescriptions in a timely manner, so they keep transferring to us, Mascaro added. As of Thursday, the virus has taken the lives of over 800 police and fire officers in Los Angeles, creating somewhat lengthier ambulance and fire response times. Because of a virus-related personnel shortage, authorities in New York City have forced to postpone or reduce garbage and subway services. In recent days, nearly one-fifth of subway operators and conductors, 1,300 individuals, have been missing, according to the Metropolitan Transportation Authority. According to Sanitation Commissioner Edward Grayson, about a quarter of the municipal sanitation department's employees were off ill on Thursday. Everyone is working 12-hour shifts around the clock, Grayson added. The city's fire service has likewise made adjustments to account for the increased absenteeism. Officials claimed that 28% of EMS employees were off ill on Thursday, compared to approximately 8 to 10% on a typical day. There were also twice as many firemen as normal. The ill rate at the police department, on the other hand, has decreased in the last week, according to authorities.